I'm one of the principal investigators for the RADx-UP CDCC. If I had to summarize what the partnership means, is it's really elevated the work that we've been able to do at the DCRI, because I think at the DCRI we have a very we can get it done attitude, and we're gonna get this done. However, in a project like RADx-UP, where it is key to partner with communities to actually execute on the research, partnering with an organization like CCPH has been instrumental for us to be able to connect with the communities that we're working with. So they have been really a pillar for this program, for us to be able to ensure that we can connect with people, that we can gain trust, and as a result, be able to then generate a lot of information that can be shared with the community so that they can apply them to their constituents and hopefully ensure that health disparities around COVID-19 decrease. I think the biggest accomplishment has been the way that we've been able in their partnership to connect with communities. I don't think that with their expertise and with their ability and their track record to connect with communities that we would have been able to do that. And without that, we couldn't have done anything else. And that's because, again, if you don't have the trust with the people that you're working with, and, academic institutions vary in terms of the trust that they have with different communities, and they were able to bridge that gap and really, everybody says meet people where they are, but do that and actually teach us how to do that. So they did a lot of training of our team, and I think that they're gonna leave a huge legacy at the DCRI just because of what they brought to the table, and they helped us see things so differently in a project that's so unique and where community partners is such a big part of what we do. And then ultimately they did, capacity building of our team to be able to even broaden that reach to more communities as more projects came along into the program. So there's a lot of things that I like about working with CCPH. One of them is the transparency and honesty. And that sounds basic, but Al and his team have a way of communicating realities in a way that doesn't feel threatening, in a way where it's easy for us to understand, and also in a way that provides context, and not only about the present, but also historical context that is critical to be able to understand what's happening in our surroundings. So I think if that piece for me has just been really instrumental, and I hope that they continue to do so, because that's really taught us how to navigate, very not only emotionally loaded, but maybe morally loaded situation with some of these communities and these partners. Well, because this is a new research area for us here at the DCRI. And, it's one thing to, we have a lot of expertise doing clinical trials and working with sites. And we have a lot of expertise in working with sponsors such as NIH and pharma companies. And we know how to do all that. But in terms of relating directly with communities and with projects working so closely with communities, we don't. So I think they brought that expertise. And they can walk the talk. They've done this before. They have the relationships, and they really helped us open a door for us to be able to engage with those communities in a way that provided trust and the ability for them to share information. So I don't think that if they would have not been at the table, it would have been very hard for us to make those connections, just because we don't have that expertise and we didn't have the community relationships. It's been such a pleasure to work with Al and his team, and it's really elevated everything that we've done. So